Welcome, willkommen. I don't know how to speak Portuguese, I'm sorry. How do you say? Bem-vindos. En tout cas, bienvenue à tous les trois. We are going to speak, on va faire en anglais, mais il va y avoir une traduction, ben voilà, vous la voyez. Donc nous allons poursuivre en anglais. Maybe first I talk to you, Paul Garassus, you wanted to introduce us.
Thank you for invitation. UEHP station.
It will come. Just a minute. Try again, please.
Yeah,
Yes,
I try it again.
that's perfect.
So my first word is thank you to FHP to invitation to present the experience of UEHP, European Hospital Federation. It's my pleasure to be president since 10 years and to have today with us two good friends, really friends. First of all, I want to introduce my colleagues. Oscar Gaspar, first, Vice President of UEHP and President of the Portuguese Federation of Private Hospital. May I say, caro Oscar, meu colega e amigo, bem-vindo a Nancy Marco para os hospitais privados.
Bravo.
Thank you, Oscar, to be here. Oscar is really a great friend, and he was in a former position, the State Secretary of Health in Portugal, really experienced at European level about discussion concerning the healthcare systems. And second, my dear friends, Thomas Bublitz, long-time dear friends from Germany. Sehr geehrter Thomas, das ist so freundlich für mich, du zu haben und immer ein Spaß, weil wir hoffen, in Berlin zusammenarbeiten. It's a great pleasure to have both colleagues and to explain what is the actual situation in Europe and to say what are the same challenges we face now according to the situation, economic constraints, recruitment problem, and so on. And yeah, now the floor is yours. Oscar, if you want to introduce your talk.
Yes, we start with you, Oscar.
Je pourrais jamais être président de l'UEHP. Hein. Jamais. Je ne sais pas comment tu fais, Paul, pour parler aussi bien.
So, Oscar, Paul decided to start with you. Can you just present us how the Portuguese health system works?
Hello. Tout d'abord, je voudrais vous remercier de m'avoir invité pour être ici. Et la personne de Lamine Gabri, je vous félicite pour cet excellent événement. C'est vrai que l'hospitalisation privée française est une source d'inspiration pour tous nous et je suis très honoré de pouvoir être ici et partager l'expérience de Portugal et le positionnement de les hospitaux privés. Mais, well, I have to speak in English to be understood.
Thank you.
And, well, in Portugal, we have a beverage-like system with a large, very strong public sector. And the public sector represents around 60% of the activity of the healthcare in Portugal. Then we have a private sector, and above private and public, we have an health regulatory authority that has a mandate to promote, we have rules independently if we are talking about public or private. Concerning the hospital activity, we represent now in Portugal about 1/3 of the activity, more in terms of medical appointments, almost 40%, and less in terms of emergency episodes, and we represent about 20% of that. But we are a key partner of the sector, no doubt about that, and we're rising. Our activity is rising in the last 10 years and continue to rise. In our private activity, we have two arms. One private arm, just private, and another arm is that our relationship with the public system. So we are also a strong partner of the national health system in terms of contribute to reduce waiting lists in terms of surgeries or medical appointments. And another thing that it's fair to say is that if we have a national health service for all the citizens for free, everyone in Portugal can go to a public hospital at zero cost. Why we have such a strong private sector? Yeah. Why people demand for private hospitalizations? And the answer is access. People feel that don't have the adequate access to the public hospitals or the public primary care. So there are almost 50% of the Portuguese population that has a private insurance. So more than 5 million of Portuguese people can go to a private hospital at a very well regulated price, and it's not easy to say this, but the National Health Service in Portugal is in a very difficult position, and in the last 4 or 5 years, when people don't feel safe to go to a public hospital, well, they have the private sector to go. Saying this, we have a lot of challenges in Portugal. Some of them are similar to the public hospitals, when we are talking about the lack of human resources, the lack of health professionals, when we are talking about the digital transition or the climate transition. Those are problems for all the hospitals. But at private hospitals, we have our own problems. When we are talking about regulated prices, when we are talking about prices that are fixed by the government, when that kind of prices do not cover our own costs, we have a problem. Mm-hmm. When we have different rules in terms of licensing or in terms of funding, in terms of public or private hospitals, we have a problem. And we usually say that we don't have private health and public health. There's only one health. There's the health of the citizens. So it would be fair to treat us as equals and treat us as key partners of the system. That's why, just one more word, that's why I think that we as private hospitals have to demand, as companies, free initiative. We need to have conditions to invest and develop our activity. We need, as providers, to be recognized, fully recognized, in terms of our involvement in health planning, in terms of adequate licensing rules, in terms of partners to the digital transition. When we are talking in Europe about the European health data space, that's not a question of public or private entities. That's a question of health entities. So we should be recognized as key players. But also the private hospitals, also as suppliers of the Minister of Health, as suppliers of national health services, we demand fairness. Fairness in terms of transparency, in terms of predictability, and in terms of economic fair rules. It is not possible to act with prices that are not real. They are just administrative, they are just prices for the government, but not a price that is possible for us to work on it. So we are in good shape, and we are investing, and we are contributing in terms of access, in terms of offer, in terms of efficiency, but we in Portugal, as in the other countries of Europe, we face a lot of problems, and we are with our colleagues and our friends of France and Germany, of course.
A lot of your problems sounds like our own problem. But I read somewhere that Portugal's healthcare system is composed of both public and private, and they are closely interconnected and mutually supportive. Can you explain us this term, mutually supportive between private and public hospital?
Well, the Portuguese waiting lists are very long. And a lot of people say, even when they are of the public system, a lot of people say that without the private sector, the old system will go down. It was not possible for us to present a good health system without the private providers.
There are contracts between both?
First thing is that we contribute to the system treating patients and avoiding that they have to go to the public system.
Keep your mouth.
Another thing is that we are partners, and as you said, we have some contracts in terms of surgeries, most in terms of surgeries, sometimes in terms of medical appointments, but in terms of surgeries. So the NHS, the Portuguese NHS, launches some kind of bids, and we have to offer our conditions in terms of how much can we do. Okay. The conditions in terms of price and time are established by the public entity, but we have to make an offer. But I have to say that in the last 3 years, we saw a decline of those kind of contracts. Why? Because prices are not adequate, and the trust between public and private is nowadays in a very low level.
Okay.
It's a pity. I think it should be more trustful relationship between public and private one, but by ideological issues, by in political terms, sometimes it's difficult for the government to contract with us, and it's bad for the Portuguese people.
Yeah. And can you talk about your relationship with your supervisory authorities? It's for Oscar, same. I would like you to talk how you feel considered by your supervisory authorities.
Well, we have, in fact, 2 supervisory authorities. The Minister of Health, of course, in terms that they are the Minister of Health, so they command all the health sector. That's one thing and one side. The other strong body is the Health Regulatory Authority. The mandate of the Health Regulatory Authority is very strong, but in fact, until now, they has 20 years, but until now, they don't fully accomplish all the mandate, because they are very strong in terms of to see what rules are being accomplished in terms of licensing and some kind of access rules. But when we talk about relationship between public and private, they do not act as they should.
Okay.
And we've made some critics to this authority. We are part of some bodies of the authority, and in all the meetings we say that the authority should be stronger and have a more strong attitude face the partners.
Paul, you wanted to add something?
Yes, I just want to add a point. Authorization in Portugal are delivered by health ministers, but private hospital can have contract with private insurance able to cover the price and the cost for patients admitted in the private sector. I think that Oscar is really experienced by this relationship, positive one, with private insurers covering costs for access to private hospitals.
Let me say just one thing more. As Paul said, the main part of our activity is with the private insurance companies. More than 60% of our activity is with the private insurance companies. So there's a B2B relationship between each private hospital and each private insurance company. And sometimes we agree, sometimes we don't agree, but it's a fair and commercial relationship, very different than that we have with the Minister of Health.
Yeah, I understand. Thomas, can you present us how the German health system works?
Yes, I will try it. But at first, very warm greetings from your German colleagues from Berlin here to you to Nancy. It's a great pleasure that we can be here, and warm greetings for you. Some facts about our healthcare system. I think the same as in every other country. We don't have enough money. And I think it's in France the same. Yeah. We have a very bad or weak economic situation. And for this, the people don't pay enough member fees for the insurances. And this is a problem for the hospitals too. Too few skilled workers like doctors and nurses. We need them and we don't find them. Mm-hmm. Too high costs. Oscar said it before. And the prices we get don't cover the costs after 2 years inflation. And this is a really great problem in Germany in the moment. 2 years, we are behind the costs getting higher, rising higher than the prices. And this is really a problem. For this, 80% of every German hospital makes losses. 80%. This is really unbelievable. Some other points who are not so good in the German system, but perhaps in France too, or in Portugal, I don't know. All the people discuss too little efficiency in the treatment. There are too rigid boundaries between inpatient and outpatient patients, or inpatient care. We have in Germany in total too much beds, too much hospital beds, but in some regions we have not enough beds. Yes, this is the situation, and the regulations in Germany are really fair, I can say it. But the public hospitals who make losses, they get in 2023 more than 1 billion euros deficit spending. And this is not fair. This is not fair. Good sides, we have good sides in the German system. The access to the treatment is low care, and you don't have to pay out of the pocket. This is really good. And I think we have really good treatment quality, and good is too that we have each, or one third each private hospital, public hospitals, and non-profit hospitals. And all these hospitals have to make the same treatments, and they get the same prices. And this is really fair. This is really good. This is the situation, and perhaps a kind of conclusion. I will say, without private hospitals in Germany, the healthcare system will collapse. This is so clear because our hospitals are not in the big cities. Our hospitals are in the regions and not in the big cities. And there we are the only one who can bring the patients treatment. Yes, one point is important. In the meaning of our politicians, private hospitals are not good. They don't like us. I can say perhaps they hate us.
They don't know, they don't realize that without you, the public system collapses.
Sorry, I don't understand you.
You said that without private, the public hospital would collapse. The government...
No, the treatment of all patients will be collapsed. The complete healthcare system would be collapsed. The public hospitals couldn't treat the patients who are in the private hospitals. It is impossible. It's unbelievable.
And the government, what does it think about this?
Yes, the government likes public hospitals. And they like public hospitals. They think that they are the best hospitals when they make a lot of losses. This is really unbelievable.
That's crazy.
But this is the situation. And what we can do, I think, let's do our job. Let's do our job. We can make good treatment for the patient. We have a good quality. We have good and friendly workers and employees in our hospitals. Let's do our job. We don't have to make lucky any politicians. Mm-hmm. Let's do our job.
Paul, you wanted to say something?
Sorry?
No, it's for Paul.
Just a word about the actual reform you are suffering off, may I say, in Germany about Lauterbach decisions. Just a word about the shift from complete hospitalization to daycare units, perhaps to reduce the cost, but we have to reimagine how to organize your own facilities to this new challenge. Perhaps a word about this situation by you.
Yes, this is a detailed problem. We don't have solutions for this. There is a decision from Karl Lauterbach. A lot of DIGs from now on are not in-care or inpatient treatment, sondern now it's outpatient treatment, and you get 30% much more lower prices. We don't have procedures for this. We don't have it. We have a lot of elder patients. You can't make surgeries with them outpatient and bring them home, and they are there alone. There are so many problems, but keep cool. We can't say it.
Yeah.
Yes, we have to take it.
Okay. We still have 1 minute. I just wanted to know, maybe for you first, Paul, what do you think about the role of Europe in this?
That's a very bad question for 1 minute or less. We have some problems. You heard about that this morning, about the French government. We have perhaps quite the same situation actual at European level for the nomination of the European commissioners. And may I say, health sector is really poor of influence, and we are trying to represent private hospitals the best we can. Nevertheless, discussion is quite the same at European level as national level, because we need consideration, respect and consideration. That's our common goal. We are always asking about money. Question is about quality, services, access, and may I say sustainability of healthcare systems. And we are the right player in this field, saying that we are perhaps the best one to express quality of care and how to reduce unnecessary costs. concerning healthcare system. So, at European level, to try to discuss about how to manage quality and access and sustainable to system, to reduce unnecessary costs and to develop private initiative, because it's not known, but European private sector is going on, the only one going on, and we try to do our best to represent and to express what initiative could support progress in EU.
Lamine.
A message for Oscar. My wife is coming from Brazil, so he sent me a message for you, and he writes me, muito obrigado por tudo. Estou muito feliz por você estar aqui.
Bravo.
Et pour Thomas, she writes me danke.
Dankeschön. Thank you very much for both of you, and for you, Paul. Thank you very much. Je m'excuse d'avance auprès de la personne qui m'a envoyé une question, pour une fois que j'avais une question, mais honnêtement, ça dépasse mes compétences de traductrice, parce que demander comment fixer le tarif des procédures, des honoraires médicaux, ou comment le régulateur émet des règles de facturation en anglais, là, je ne pouvais pas. Donc, si vous voulez, pendant la pause, peut-être que vous pourrez poser directement votre question.